Hello, today I'll be introducing a simulation of fluidotherapy. This is a thermal agent therapy that we can use prior to a active range of motion session. This session is going to last about 20 minutes. It is a machine that's plugged in that is cleaned and assessed for maintenance. Usually every so often, probably a couple times a month, but other than that, it is low maintenance. And I would have the patient wash their hands thoroughly before this session and make sure that they are dry. I would also have them remove any jewelry from them because heat or metal is a conductor. So we want to make sure that they don't have any jewelry. And this therapy is specifically for distal extremities. So upper distal extremities or lower distal extremities. I also, prior to putting my patient through a session, want to make sure that I assess their pain tolerance, any sensation, check their chart for any COPD, which would be like a contraindication because of the excessive dryness or heat, and make sure that they are able to stay in this seated position for an extended period of time. What sets this thermal agent apart from like a paraffin or hot pack is that we can have the patient mobilize during this session. So they can do stretches or exercises. We can use a small ball that they can benefit from in addition to the heat, which is awesome. Another thing with this treatment is that, unlike the other treatments, is that it does not lose heat integrity as time goes on. You can adjust the heat and it will remain a constant heat the entire time. Another thing when we're assessing for the skin before we place the patient's distal extremity in is to assess for any skin integrity like abrasions, open wounds, scabs, versus like paraffin where we wouldn't necessarily go through a treatment with those types of things on the skin. In this case, we can make sure that they are completely covered and airtight and they will be able to complete the activity. This treatment is going to be great for people with acute injury or pain relief or increase of range of motion, tissue healing, and it's a low maintenance machine. So they're going to be on this for about 20 minutes and we wear between about 100 and 118 degrees. And I will, stand with the patient for the first couple minutes to make sure that the heat and the sensation or the aggravation is the patient is able to withstand those parameters. So I'm going to have my patient be doing their left arm today, so kind of just right before the elbow. And I'm going to say, sir, have you ever done fluidotherapy before?
No.
Okay, this is going to be a machine that we can set the temperature to. You're going to feel some pressure and some air moving around. Heat is normal to feel. You're going to be placed into, if you want to hold this ball while you go into the machine, you'll feel some pressure, so heat is normal. So go ahead and place your arm in here. So they would have washed their hands completely and they would have dried them completely before putting in this machine. And you would have a Velcro strap, which you would just Velcro their arm to, making sure anytime you tighten anything around an extremity, you want to make sure that they that no blood vessels or there's no nerve impingement happening. And so their hand would be placed into the fluidotherapy machine, and I would say, sir, how's the compression over your arm here? Is it too tight or too loose?
Perfect.
Great. I would go over here and I would set the temperature, and I would set the aggravation, so like how strong the pressure is or the airflow and the particles moving around. And I would ask him, how's the temperature for you? Is it too hot?
Nope, it's perfect.
Okay, so after he would wash his hands, I would check his skin. I would seal up any abrasions. I would place him in there, set the temperature and the aggravation level, and have him kind of just, okay, now that you feel that the machine is on, go ahead and give me a couple pumps there with a ball. You can do some wrist circles if you'd like. Okay, great job, and 20 minutes would be over. I would turn off the heat and the aggravation. I would undo the Velcro, and I would kind of just hold the sleeve on him so that none of the particles get loose as he removes his arm. And you can bring the ball with you. Great job. Okay, and then normally I would have a towel nearby to just wipe off anything. I'd grab the ball from him and assess. There should be some pinkness or some light redness, and it should be a little bit hot to the touch. But did you have any pain or experience any adverse effects?
No.
Okay, and that would be a successful treatment, and we can now move on to some active range of motion or active assisted range of motion activities. And that was fluidotherapy, thermal agent, superficial heat modality.